Hey, good evening. Good evening. Good to see all of you. I'm Cindy Baker, ADHD productivity coach. And we're going to kind of talk this evening about um, ADHD 101. So, the title was How Do You Know If You Have ADHD? But I've decided to just kind of talk about what it is, what the symptoms are, and all of that. So if you are watching live, if you could say hi in the chat, I'm going to pull it up here on Facebook and make sure I'm streaming like I'm supposed to. Okay. I see myself. So hopefully you can too. If you could just say hi in the chat, if you're watching live, and if you're watching the replay, just whatever platform you're watching this on, if you could let me know where you're tuning in from, that would be awesome. So I know it takes a few minutes for comments to come in. Yep. Okay, I can tell I'm live. Um, so what is ADHD? ADHD, adult ADHD, it's a neurological brain disorder in which you have trouble paying attention, which is why they call it attention deficit. It's really not a deficit of attention, though. We pay attention to too many things. You might also tend to act on impulse or seem to have too much energy. About 4 to 5% of US adults have ADHD, which stands for attention deficit hyperactivity disorder. So every adult who has ADHD had it as a child. It's not something that you can get as an adult. Some people were diagnosed in childhood, but others only found out later in life. I was one of those. I didn't get diagnosed until I was an adult. So while many kids with ADHD outgrow it, about 60% still have it as adults. And there's no cure for ADHD. If your doctor says you have it, you'll work together to make a treatment plan that's just for you. And when you have adult ADHD, your symptoms they can range from mild to serious, and they can even change over time. And they may affect you a lot, or they may not really bother you that much. They can be problems all of the time, or maybe it just depends on the situation. So if you have ADHD, you may have issues with concentration, following directions, remembering information, organizing tasks, procrastination, boredom, anxiety, depression, controlling anger, impulsiveness, low self-esteem, mood swings, relationship problems, substance abuse or addiction, motivation, restlessness, talking too much. No two people with ADHD are exactly alike. And so you may be able to concentrate if you're really interested in or excited about what you're doing. But some people with ADHD have trouble focusing under any circumstances. Some people look for stimulation, other people avoid it. So some people with ADHD can be withdrawn and antisocial, and others can be very social and go from one relationship to the next. So you can be an introvert or an extrovert and have ADHD. Let me get a drink real quick. So if you have adult ADHD, you could have a long-term pattern of issues in a lot of different areas of your life. Maybe you had problems in school, history of bad grades or repeating a grade, or maybe you were gifted and just were able to get by. Maybe you got in trouble at school, maybe you have problems at work, frequent job changes, poor work performance. Maybe you're restless and unhappy with your job, problems in different areas of your life. There's a high correlation to speeding tickets and car crashes. Or having your license suspended, smoking or using alcohol or drugs, money problems, relationship problems. Maybe you've had unstable relationships or a history of separation or divorce or multiple marriages. it varies, and there are different types of ADHD in adults. There's three main types. There's inattentive, and with this type, your symptoms are mostly about being distracted and having trouble paying attention. So you might be disorganized, maybe lose things often, or have trouble following instructions. Doctors used to call this type ADD and leave the H out. Um, and then there's the hyperactive impulsive ADHD. And if you have this type, most of your symptoms center on acting impulsively or being overactive. You might feel restless or have a hard time sitting still, or you talk a lot. You also may interrupt people or have a hard time waiting your turn. And then there's the combined ADHD. That's the most common type of ADHD. And if you have it, you may have some symptoms of both of the other types. So again, if you are watching, if you could let me know in the chat. The chat is very quiet this evening. So if you're watching live, let me know. Just say where you're tuning in from. And if you are watching the replay, let me know that as well. And put any questions, reactions, anything like that in the chat. That would be awesome. So those are the symptoms. What causes ADHD in adults? And scientists really aren't sure. They aren't sure exactly what causes someone to get ADHD, but research has shown that it does run in families. So they do know that people with ADHD have differences in the way their brains are structured neurologically. It takes their brains longer to become fully mature. And the nerve cells that send and receive signals in the brain work differently in people. That's why we call ourselves neurotypical and neurodiverse, because it has to do with the neurology in our brains. And studies have found absolutely no evidence that ADHD is caused by poor parenting or sugar or too much screen time. There are no studies backing up those theories. And so it's possible these things could make ADHD worse, though, for sure. There's some risk factors for adults that have ADHD. You're at higher risk if you have a close relative, like a sibling or a parent with the condition. The odds are 1 in 4 that a child with ADHD has a parent who also has it. And so researchers are looking at other possible risk factors like alcohol use, smoking, drug use during pregnancy, brain injuries, things like exposure to toxic substances in the environment, like lead and paint in the womb or during childhood, premature birth, low birth weight, all of those type of things they're looking into, but they really don't know. There's one large survey that found that 4.4% of adults aged 18 to 44 in the U.S. have ADHD. About 62% are men and 38% are women, according to that survey. And the ethnic group most likely to have a diagnosis is non-Hispanic white people. So just a little trivia there. So how do you figure out if you have ADHD? How do you get the diagnosis? There's actually no test that can diagnose ADHD. So if you think you might have it and you want the official diagnosis, which you don't have to have, by the way, but there are some benefits to that, then you need to look for a psychiatrist who has experience with diagnosing and treating people with ADHD. And that doctor may ask you to get a physical exam first to make sure there's no other medical problems that are causing your symptoms. They may take a blood test and may recommend some psychological testing and things like that. And they'll ask, there's a series of questions that you'll have to, it's actually very long, that you'll have to answer about your health history and your behavior history and things like that. And while experts don't agree on an age when you can first diagnose ADHD, they do agree that people don't suddenly get it as adults. So I've seen some people in online forums try to argue, they're frustrated with their doctor because the doctor doesn't believe them that they have ADHD. Well, they probably don't because they didn't have it as a child. And so it's not something you develop as an adult. That's why when a doctor sees you, they're going to ask you about your behavior and any symptoms that you had as a child. So you're going to have to dig deep if you're older to remember some things. They might even ask you to look at old school report cards to see if there's comments about behavior problems or poor focus, lack of effort, underachievement, compared to your potential. And it's always a good idea if you can to talk to your parents to see if you had any of these symptoms during childhood, because they can tell you. And the doctor is also going to ask whether anybody else in your family has a diagnosis of ADHD. So it's really more of a battery of tests. You take a self-assessment usually, and then the doctor will ask you questions as well. Sorry about my voice. Hold on. So once you get that diagnosis, the treatment can include medicine, therapy, learning more about ADHD, getting family support. All of these things can help you find new ways to do things that make your day-to-day life easier. That can make you feel better in general and feeling better about yourself. So make sure you get fully checked out by a doctor. That's super important. And not everybody needs medication that has ADHD. And you do need to see a doctor because people with ADHD often face other conditions too. So you might also have a learning disability or anxiety or another mood disorder, maybe obsessive compulsive disorder or depression or dependence on drugs or alcohol. Excuse me. So knowing the whole picture is really important. That can it'll help you make sure you get the best plan for you. So again, if you're jumping on live, say hi in the chat. I don't see anybody commenting in the chat. This is making me very sad and lonely. Please say hi. And if you're watching the replay, let me know. So I'm not a doctor. I'm not giving medical advice, but I'm just going to kind of give you an overview of medications. The most common is stimulants. Adults with ADHD are often prescribed stimulant medications, and studies show that about 2/3 of adults with ADHD who take these medications have big improvements in their symptoms. And these are things, you've heard of some of these like Adderall, Concerta, Ritalin, but stimulants aren't always ideal. So not everybody finds success with those because they can be addictive. Stimulants are controlled substances, and that means that they can be misused. Some adults with ADHD have substance abuse problems or have had in the past. And so they like to stay away from that kind of thing. These stimulants medication can be hard to remember to take because you got these short-acting types of stimulus versus long-acting, and that may wear off quickly. And since people with ADHD have trouble with forgetfulness, remembering to take them several times a day can be a real challenge. It's hard to time it just right. And if people choose to stop taking them in the evening, they can have a hard time focusing on things they need to do after work, like housework, paying the bills, helping the children with their homework, driving, but if they don't take them later in the day, but if they do take them later in the day, they may be tempted to use alcohol or other things to relax because they're all hyped up and they want to be able to go to sleep. So there's pros and cons. And there are some non-stimulant medications that a doctor may recommend. They may have you take that on its own or with a stimulant. And these are things like Strattera that you might have heard of. Um, Cognitive behavioral therapy is very effective for people with ADHD. So, in addition to medication, they might recommend some behavioral treatments as part of your treatment plan. Of course, ADHD coaching, life coaching, particularly geared for ADHD, is extremely helpful. Some doctors know about it and recommend it, and some don't, but I don't know any that are against it. So I know in my group coaching program, I help people set goals, help them get organized, manage their time, work on productivity, clutter. There's just so many areas that it helps with stress management, helps lower that anxiety, and you learn new ways to get organized at home and at work. And so you at work maybe want to get a mentor that can help support you at work, and it can help you have better working relationships and improve on the job performance. Maybe you need family education or family counseling, so your loved ones will understand your ADHD better. I have a free Facebook group where people learn about ADHD. This is one of the places this is being streamed tonight. But getting support from others, it can also help you find ways to lessen how much it affects everybody else's life. And there are some alternative treatments that are non-medication, but the research is really still out on that. They haven't found much evidence that any alternative treatment can relieve symptoms of ADHD. So if you're considering an alternative treatment, make sure you talk to your doctor first. They can help you weigh the benefits and the drawbacks. So experts once thought that children outgrew the condition. So a lot of healthcare providers lack training about adult ADHD. So you want to find someone who knows about adult ADHD. And if you're looking for a coach, I know about adult ADHD. So make sure it's not somebody who just read about it in a book, but who really has worked with people. I myself have ADHD and have figured out a way to be successful. But a lot of adults with ADHD also have other conditions like depression or anxiety, and those issues may overshadow the ADHD symptoms. So you do want to make sure you're talking to a doctor. Men make up 62% of adults with ADHD, and women make up 38%, according to one large survey. So by comparison, boys are more than twice as likely to be diagnosed with ADHD. And, some experts think that that's because the inattentive symptoms that women tend to have don't go away as you get older, but the hyperactive symptoms, which are more common in boys, do tend to decrease as they get older. So when you have ADHD, even simple things like going to the grocery store, paying bills can feel overwhelming. Anybody can have mood swings and loss of focus and trouble staying organized, but you deal with that every day if you have ADHD. And so it is not something that you want to try to tackle on your own. There are some things that you can do, but you're going to probably need support and structure and accountability to implement those strategies. Because one study found that on average, adults with ADHD spend an extra $2,500 a year on healthcare, including medications and doctor visits. But untreated ADHD costs even more because you have things like late payment fees and impulse spending and traffic tickets and just all the cost of unmanaged symptoms. So ask for help if you need it. We all need help from time to time. It's important to not be afraid to ask for it. And if you are interested in finding out more about how you can use ADHD to your advantage, I have a free webinar this Thursday night from 7 to 8:30 p.m. And I'll put if you're watching this in Facebook, I'll put the link there. If you're watching it somewhere else, just reach out and I'll send you the link. So just to end, I'm going to give you kind of a recap of some signs of ADHD, but some that maybe are a little atypical, like things you might not have thought of. The first is hyperfocus obsessions. It's typical for adults with ADHD to struggle maintaining focus, but some have the opposite. They get so absorbed in a specific activity that they lose track of time. And so it's like a blessing and a challenge, really. Another is impulsive decision making, maybe impromptu purchases or blurting something out impulsively. Some people make impulsive career changes and relationships or life-altering decisions without really fully considering the consequences. Emotional dysregulation. Sometimes this is overlooked, but this is real. Adults with ADHD often contend with intense emotions that may change rapidly, kind of like a teenager. And that affects relationships and coping strategies. So that's something that people don't always mention. Another is sensory sensitivity. Like I had a meltdown in IKEA because of this, because we're hypersensitive to sensory stimuli like lights, sounds, textures. And it just makes us uncomfortable and irritable, like sensory overload. Chronic procrastination. Procrastination is common for people with ADHD. Waiting till the last minute to start something but some people just avoid responsibilities altogether. Another sign is difficulty with routine tasks. Managing daily routines and household chores, that can be challenging for people with ADHD. Even just something straightforward like meal planning or budgeting or keeping a clean living space can just feel daunting to an ADHD person. Impaired executive function. Adults with ADHD struggle with things like organization, time management, planning. That can lead to chronic lateness, missed deadlines, a feeling of being overwhelmed, all of that. And another is invisible anxiety, because anxiety often accompanies ADHD, and it can manifest as restlessness and racing thoughts or this constant sense of unease. Excuse me. And so a lot of times those symptoms aren't recognized as signs of anxiety, and they can be mistaken for typical ADHD traits. So which one of these did you relate to? Put in the chat if you relate to any of these. Remember, everybody's experience is different, unique, and these are atypical signs. They're not going to apply to everybody, but recognizing and understanding them can help you, get the support that you need. So if you want to delve deeper in any of these topics or you have questions, feel free to reach out to me or join my informational webinar. It's called the ADHD Advantage this Thursday, October 12th, 7 to 8:30 p.m. Central. You can register for free. I'm going to tell you the link, but I'll also put it in the Facebook group. It's a bit.ly link, bit.ly/ADHD Advantage registration. So https://bit.ly/ADHD Advantage registration. So if you want to chat with me about what it would be like to be in my coaching program, it's a brand new coaching program called the Ultimate ADHD Success Blueprint. And it is changing lives right and left. So if you want to chat with me about that, then reach out to me and let me know that you're interested, and we'll book a call on Zoom, and we can chat for free. So great talking with you all. Very quiet in the chat tonight. Hi, Lisa, making us all jealous because she's in Hawaii. And looks like Becky's watching, but she's not saying anything. So anyone else who's joining in, if you're watching the replay, which a lot of people do, please say hi in the chat. Let me know that you are here. And I hope you have a wonderful week. And if you think you might have ADHD and want to know more, reach out to me and get some support. Don't try to struggle alone. Have a great night, and I'll see you next time. Bye.